Hello everyone, I'm Pharmacist Michael, and today I'm going to talk about chronic fatigue syndrome. Chronic fatigue syndrome, or CFS, also known as encephalomyelitis, affects up to 2.5 million Americans of all ages. One of the main problems with this disorder is many physicians don't properly diagnose CFS, and as a result, it is estimated that over 90% of these patients within the United States are undiagnosed. Part of this is because diagnostic tests often come back normal. Some clinicians question the legitimacy of chronic fatigue syndrome. Because of this, patients may not be properly diagnosed for many years and after seeing multiple providers. We also know that previous clinical treatments for CFS, such as cognitive behavioral therapy, or CBT, and graded exercise therapy, or GET, are ineffective and may actually worsen chronic fatigue syndrome. To make matters worse, many patients have CFS-like symptoms lingering after a COVID-19 infection. The U.S. National Academy of Medicine, or NAM, created new treatment guidelines for CFS in 2015. They also removed the recommendations for CBT and GET. We hope that this will eventually lead to better treatment of this devastating disease. Where does chronic fatigue syndrome come from? Well, we know that it follows an infectious illness, including COVID-19, in at least 80% of patients. We also know that women are 3 times more likely to be affected than men. The symptoms of CFS include a substantial reduction in the patient's ability to function in occupational, social, educational, or personal activities for a period of 6 months or more. Post-exertion malaise, or PEM, is the hallmark symptom of CFS. PEM is the worsening of symptoms following even minor physical or mental exertion, with symptoms typically worsening 12 to 48 hours after activity and lasting for days or even weeks. Even healthy people experience fatigue and muscle pain after exercise, but CFS sufferers also experience poor sleep, memory problems, poor concentration, flu-like symptoms, and poor mood. Further, in both healthy and sick people without CFS, exercise improves pain, sleep, fatigue, concentration, and mood. This is just the opposite with CFS. Other symptoms include hypersensitivity to various stimuli, including light, sound, touch, chemicals, food, smells, and orthostatic intolerance. The impact this condition has on sufferers is enormous. Up to 75% of these patients are unable to work, and we think around 25% are housebound or bedbound. We also know that this disease waxes and wanes. Up to 61% of these patients state that they are bedbound on their worst days. And remember, 90% of these patients in the United States are undiagnosed. So this is a huge problem. Why aren't there better treatment options for CFS? Well, first of all, studies have small sample sizes and high dropout rates because these patients don't have the energy or ability to continue. Most are also suffering from other conditions, which makes it hard to focus just on CFS. And it's hard to follow up with these patients for an extended period of time. One systemic review of the available data concluded that the chances of recovery from CFS is only about 5%. Many patients will experience periods of remission, but relapse is common. The diagnosis of CFS is made by asking the patient a series of questions. These questions should be specific to the CFS symptoms. Patients should be instructed to keep a journal for a couple of weeks outlining their physical activities, environment, mood, energy level, etc. This can help the clinician determine if CFS is a possibility. Diagnostic tests are important to rule out other conditions that might mimic CFS. Chronic fatigue syndrome has no specific diagnostic tests available presently. How do we treat CFS? The first step is to validate the patient's symptoms. This disease is pushed aside and often misdiagnosed. Physicians might think the patient is a hypochondriac, suffering from anxiety or depression, or just minimize their symptoms. These patients need support, as I have said in other videos. My recommendation is to try to find a practitioner who specializes in CFS. These practitioners should provide the patient with resources for education and work accommodations, disability programs, and support groups if possible. Pacing is very important in chronic fatigue syndrome. Pacing is a process to conserve energy and minimize the negative effects of post-exertion malaise. Patients should be taught to carefully plan how to spend their limited energy. There are many aspects to this, but finding a physical therapist who specializes in CFS can help. Remember, energy tolerance in these patients can vary on a day-to-day basis. Some possible interventions to help decrease energy consumption in these patients are motorized scooters, shower chairs, and handicap parking stickers. They might also benefit from shorter work hours or less work days per week. It is also crucial that these patients monitor their environment. Perfume, cigarette smoke, and high levels of pollution can have a major effect on this disease. Orthostatic intolerance can be helped by utilizing compression stockings or drinking water and increasing salt intake. Electrolyte drinks may also help. Patients should also be instructed to get up slowly from a lying or sitting position. There are also drugs available for orthostatic intolerance. These include fludrocortisone, alpha agonists, desmopressin, pyridostigmine, and low-dose beta blockers. Sleep issues can be improved by following basic sleep hygiene practices. See my video on the 5 pillars of health for more information on sleep hygiene. Medications are also available for sleep, including trazodone, melatonin, low-dose tricyclic antidepressants, mirtazapine, quetiapine, and others. Remember, these drugs all possess side effects, and they may zap the little energy these patients have, so please be careful. For fatigue and cognitive dysfunction, pacing is critical. There are also simple memory aids that can be used, such as calendars, timers, etc. Drugs include stimulants such as methylphenidate and modafinil and caffeine. For immune system dysfunction, IVIG, inosine, pranobex, or hydroxychloroquine can be utilized. Pain can be treated by a variety of methods. I always recommend starting with turmeric if you aren't currently taking an anticoagulant. Sunshine Nutraceuticals has 2 turmeric products available. Links to these products can be found in the description section of this video. Other treatments include hot and cold packs, acupuncture, physical therapy, massage, and neurofeedback. Medications such as low-dose naltrexone, SNRIs such as Cymbalta, gabapentin, pregabalin, muscle relaxants, NSAIDs, Tylenol, tramadol, and amitriptyline can be utilized. Some patients may also benefit from CBD gummies or marijuana for pain. Chronic fatigue syndrome is a devastating condition that is underdiagnosed in the United States and other parts of the world. These patients have a very hard time functioning day to day. This video has only scratched the surface, but I believe awareness is always the first step to improving treatment protocols for patients with various diseases. These patients are not hypochondriacs and not trying to get attention. They suffer from post-exertion malaise, which negatively affects their daily lives. Most of them became ill with CFS after suffering from an infectious process. COVID-19 has increased the incidence of CFS, and many people with long hauler symptoms are thought to be suffering from chronic fatigue syndrome. As always, if you are suffering from CFS, I recommend finding a practitioner who specializes in this disorder. Many clinicians are not aware of the new treatment options available. If you know somebody with chronic fatigue syndrome or somebody who would enjoy this video, please send it to them. If you've enjoyed this video, give it a thumbs up, and please subscribe to this channel for more health and wellness information. I'm Pharmacist Michael. Be happy and be healthy.